Good morning, everybody. This is the Kern County's regularly scheduled Thursday morning press briefing related to COVID-19. As always, I'm joined by Matt Constantine to provide information from Public Health, and we're also joined by Kim Hernandez, the lead epidemiologist for Kern County, along with Dr. Chris Lyon, who is our public health officer. They're both here to answer questions that you may have this morning. We're pleased this morning to be joined by the chairwoman of the Board of Supervisors, Leticia Perez. I'd like to ask her to come to the podium. She'd like to give some remarks.
As the chair of the Kern County Board of Supervisors, I am very pleased and grateful to announce that yesterday afternoon, we received word that Governor Gavin Newsom approved our board's request to move deeper into Phase 2 of his four-part reopening plan. Hats off to my colleagues, Supervisor Zach Scrivener and Mike Maggard, who were the spearhead to make this possible. The county submitted our detailed plan on how to reopen to the governor's office at our board session Tuesday, and within 24 hours, it was approved. What this means is that retail shops, restaurants, and malls will now be able to open for in-person use, so long as they abide by the strict state health guidelines. These guidelines include the use of masks and gloves by employees, frequently cleaning and disinfecting the facilities, and the enforcement of social distancing by limiting the number of customers a business will allow in at any given time. We believe that by following these guidelines, our county can safely and responsibly begin to reopen our society and get people back to work. Additionally, we see Governor Newsom's decision to open during this Memorial Day weekend as a clear and strong demonstration to his commitment and trust in Kern County. By choosing to partner with communities at the local level, we will now be able to have the opportunity to kickstart our economies and move our people closer to the financial stability we are all yearning for. I, for one, am proud to see Kern County's local medical experts, businesses, and community leaders take center stage for a well-deserved bow in front of all of California. It is precisely because of this community building that we have earned, retained the ear, attention, and grace of our governor. I would like to take some time to specifically thank some very important partners who were key in supporting us during these difficult times. Of course, our county family, Matt, Ryan, and many others, Good Samaritan Hospital, along with Kern Health Systems, Sean Penn and Ann Lee from Community Organized Relief Effort, MLK Community Initiative, Western States Petroleum Association, and of course I have to thank all of the volunteers who stepped up in our hour of darkness to find a way to help our fellow neighbors in need. This truly is the best of us. From the bottom of my heart, thank you.
Good morning. My name is Matt Constantine, Director of Kern County Public Health. I again want to thank our ASL interpreters this morning, Stephanie and Alexandra, so thank you. I also want to recognize that this week is EMS week. So this is the week that we want to recognize our EMS providers, our first responders, not only as it relates to COVID-19, but also all of the other responses that we depend on, our 911 calls, our hospitals, our law enforcement. This is the week that we, in particular, want to say thank you. So, thank you. This morning, we are announcing that there are 39 new cases of COVID-19 in Kern County residents. I also want to provide a quick update on some of our skilled nursing facilities. So for the Kingston Healthcare Center, as of May 20th, we have 53 healthcare workers that have tested positive. We have 77 residents that have tested positive, and there are now 15 deaths of residents from Kingston. Staffing continues to be an ongoing issue. The state has deployed a team, a medical assistance team that has been on site. That team is starting to demobilize, and they have extended now until May 30th There'll be 14 staying on site through May 30th as Kingston is staffing up and is stabilizing their staffing plan. Valley Convalescent Hospital is a second site that we have been engaged in. As of May 20th, the state has reported to us that there are 16 healthcare workers that have tested positive, and there are 18 residents that have tested positive. Again, both Kingston and Valley Convalescent are state-regulated facilities. There's 19 in total. Those are 2 that we're watching closely. As we've mentioned before, FEMA has indicated that they are going to provide a 2-week supply of PPE to all of our skilled nursing facilities. Those shipments are to arrive yesterday and today. So we're grateful that that additional PPE is being made available to our skilled nursing facilities. As we've mentioned before too, the county has deployed a skilled nursing facility testing program. This is in an attempt to help our 19 facilities gear up and to initiate a testing program to test not only workers, but to test residents. Yesterday, with the help of the California Department of Public Health, we met with all skilled nursing facilities to talk about the state requirement to initiate this plan and also to talk about how the county will help in the initial phases of this plan. So we did test 70 employees at Valley Convalescent. We tested 158 at Bakersfield Rehab Center. Today we are at the Height Street Skilled Nursing Facility, and next week we will be at Brookdale. So that program is well underway. And then finally, the antiviral that we've been talking about, remdesivir, we are receiving shipments today from the state. We've been told there will be 161 doses of this antiviral delivered today. We will immediately distribute that, of course, to our local hospitals. That concludes my comments. I will turn it over to Ryan.
You all set? Okay, good morning again, everybody. My name's Ryan Alsip. I'm the Chief Administrative Officer for Kern County. I want to thank Matt for his comments. I also would like to thank Chairwoman Perez for being here this morning and her remarks. Today in Kern County, as we've reached nearly 19,000 tests administered for COVID-19, with almost 90% of those tests coming back negative to date. Of the nearly 972 tests that are pending results, that represents just about 5% of the total amount of tests given. The vast majority of those tests are likely negative. Again, that is a process where public health officials have to track down and find out and get confirmation on whether or not those tests were negative prior to us publishing data. It is different than the reporting requirements associated with positive cases. So wanted to again say that 972 of those tests are pending confirmation by public health officials for the results. Today, of the 1,644 positive tests of residents for COVID-19, 96% have fully recovered or are recovering at home. In Kern County, on a daily basis since late March, tracking the numbers, 96% of those residents who have tested positive have either fully recovered or are recovering at home, treating their own symptoms. Today, 38 people, or 2% of the total positives, are receiving some form of treatment in an area hospital. 25 people have died since we began publishing COVID-19 data. And according to state public health officials so far, over half of the total deaths in Kern County are related to patients at 2 different state regulated skilled nursing facilities. And as Matt said, 15 of those 25 deaths are attributed now to skilled nursing facilities. I also want to pause and take a moment to talk about the people that we have lost to the flu this year, not comparing the flu to COVID, but we have lost 20 Kern County residents this year to influenza during this flu season, including children. And so let's not forget about those people in our community who lost their lives to the flu. They're not just statistics. They're people. They're loved. And it's important that we remember them. Typically in our county, obviously when we're not dealing with COVID, flu deaths are a leading news story on the nightly news and in the paper. And so I wanted to point that out and recognize and remember those individuals. Yesterday, Kern County, as Supervisor Perez stated, received notification from the state from the California Department of Public Health that our attestation that was submitted on Tuesday evening was approved. That means that Kern County can begin to more quickly open restaurants and shopping centers, retail establishments. I want to thank Governor Newsom, and I want to thank Dr. Mark Ghaly for listening, for acting quickly, being available, for their work. I know that running a state and addressing this, a state of 40 million people, is a tough job. There is no playbook on how this is done, and I want to again thank them for the attention that they've given us here in Kern County. It's appreciated, and we will continue to maintain the relationship that we have with the administration as we continue to move through the various stages of the governor's reopening plan. So what does this mean for Kern County? Today, as early as today, restaurants can begin to have indoor dining. Retail establishments can begin to allow folks into their stores. That must be done in accordance with state guidelines. There are some very specific things in these guidelines. There are some recommendations and considerations in these guidelines. There are things that must be done in these guidelines. We're asking all businesses within those two industries specifically to adhere to the governor's guidelines. This has got to be done carefully, and we ask that to the fullest extent possible you implement those guidelines. I would also ask patrons of those businesses, please understand the environment that these businesses are in, these restaurants, these retail establishments are in. Please adhere to their guidance to you as you patronize their establishments. Pay close attention to signage, anything that they're asking of you. If you're visiting those establishments, please participate, and thank you in advance for your support. This participation, this adherence to guidance is going to be important on how we move forward, and obviously is going to be important to continuing to manage the spread of COVID in our community, which continues to be here. I want to talk about what's not open. I've had some questions about what's not open, and let me tell you what's not open per the state of California. What's not open are personal services such as hair and nail salons, tattoo parlors, gyms, fitness studios, hospitality services such as bars, wineries, tasting rooms, and lounges, entertainment venues such as movie theaters, gaming, gambling, and arcade venues, and pro sports, indoor museums and gallery spaces, zoos and libraries, community centers, public pools, playgrounds and picnic areas, religious services and cultural ceremonies, nightclubs, concert venues, live audience, sports, festivals, theme parks, and rounding out the list are hotels and lodging for leisure and tourism. This is per the state of California. These businesses, these industries are part of Stage 3. The governor and his team has said that they will likely move into Stage 3 as soon as the end of the month. We're hoping that that's the case. We would like to see these businesses get open and running, these venues get back to some normalcy to the extent that they can. Again, once they do, they'll be operating under state guidance. We continue to have discussions with industry groups here in Kern County where we're focusing on getting all businesses reopened that we can as quickly as possible in the safest and most responsible manner. Again, we have regular calls with industry groups. We've had many this week. We had many last week. We will continue to have many going forward. That's not going to stop. This is about maintaining continuity of planning, continuity of communication among everyone, understanding where we are, where the state is, where we are locally, what we're able to do for them locally. So that will continue. Finally, before we get into questions, I want to say that the Board of Supervisors on Tuesday approved a financial assistance package for area small businesses. We are going to be focusing this financial assistance on small businesses that have been affected under the governor's orders. These are businesses that were closed, that were listed as non-essential. These are businesses like restaurants, businesses like hair salons, gyms, and others like them. This is not a financial stimulus program like the federal PPP program. This is a program that has been organized and developed locally with greater flexibility. We are focused on providing the greatest amount of value to our area businesses. We're focused on getting this done as quickly as possible and working with you along the way. Those of you that are interested in accessing this money can look to kerncounty.com as early as next week, probably Tuesday, where we will have information on how you can apply to receive this financial assistance. That'll be front and center on the county's website as early as next Tuesday. In addition to that, we're going to be proactively reaching out to your businesses directly, the county to you. We will be working with chambers of commerce. We will be working with other officials in other cities throughout Kern County, the city of Bakersfield, et cetera, to make sure that you are aware of this program and you submit an application as quickly as you possibly can. So with that, I am going to end. I'm going to ask that now we get into questions. I've got a little instruction here on how we do this. So members of the media, I have a list. I'm going to walk through and announce, ask individual organizations one at a time if you have any questions. Again, you should all be on mute right now. And as I call your organization, I'm going to ask you to press the star button and then 6, the number 6, to unmute your phone one at a time. We will take questions, and I am willing to take as many questions. We'll call this the Ralph Bailey rule. Take as many questions from any news organization, as many as you have, as long as you're not being repetitive and as long as we're not providing the same answer. So keep it interesting, and we will take as many questions as possible. So with that, I'm going to ask for questions from KNZR. KNZR, are you online? Do you have any questions? I'm going to move along here. Okay, I'm moving along. KUZZ. No questions from KUZZ. Bakersfield, Californian.
Hello?
Yes, we hear you.
Yeah, this is Sam with the Californian.
What's up, Sam?
My main question that I have is, are there other businesses like schools or childcare facilities in stage 2 that are not yet allowed to be open, or can they open as well right now?
I believe there are, the child care facilities are part of stage 2 and can operate within guidance that is provided by the state of California. That guidance is found on the state's website, and we can certainly make it available on our website as well. But the state's website is covid19.ca.gov. There is some ability locally for local public health officials to provide guidance for schools. However, obviously, we're at the end of the school year here. I think some of the school districts have made plans already for how they're going to handle summer school, and really work with schools is going to be more focused on how schools come back for next year. And I think most of the focus is going to be on how they do that going forward. Again, it's an evolving situation. We're going to be hearing from the state in the days and weeks to come about how schools are to be reopened. I'm sure they'll be providing guidance. I haven't seen that guidance yet, but under stage 2, let me go over the industries that are in stage 2 currently. It's retail, restaurants, obviously I talked about, manufacturing, logistics, distribution centers, offices. If you're not able to telework, office-based businesses can get back to work. Outdoor museums can be operating, in addition to some limited personal services. So, Sam, I hope that answers your question. Do you have any more?
Yeah, my other question that I had was the letter that the county sent the governor last Friday, and just how much credit do you think that the county deserves in getting the governor to relax the criteria to allow more counties to open back up?
Well, first let me say that it's important for people to know that first the governor provided a pathway for counties to have variance. Counties were asking for that. We were asking for that. He provided that. To the governor's credit, to his administration's credit, they were willing to listen. They had said several times that frankly, they didn't know it all, and that they're willing to listen and to make changes where changes are due. Consider modifying the county guidance. They put that out there, and we made an effort to convince him to make changes, some specific changes. And so, I give the county a lot of credit. I think that we worked very hard. We had a lot of people focused on this. I want to thank our medical leaders in this community, the administrators at our 10 area hospitals, along with their chief medical officers, who joined us in petitioning the governor to make changes specifically related to the rate of hospitalizations, which has become a foundational key component of his guidance for counties, again, which we meet. And so I'm pleased with where we are, and it was really a combination of the work of this community, this county, and the governor's team willing to listen and to frankly provide a very, very quick turnaround on our attestation. Again, that was, as Supervisor Perez pointed out, that was sent up on Tuesday. We heard back in less than 24 hours. So we're quite pleased. You have any other questions, Sam?
I do have some, but I'll let other people go first.
That's nice of you. I'll come back to you at the end if we've got some time. Kern,
Okay.
Kern Radio, Ralph Bailey, are you on the line?
Yes, sir. Can you hear me?
Yes, sir.
First, let me say that was pretty funny, Ryan. That was a bait up the middle. That was pretty funny. I only have two, however. I only have two. First, the issue of masks. This is becoming as divisive as anything. Stay at home, get back to work. We've seen shootings in L.A., fighting at a grocery store. We've seen mass gatherings here downtown, and not a soul wearing a mask. It's almost a symbolic defiance from the folks that poo-poo the science and the stay-at-home orders. Does the county have a position on masks, and is there any talk of joining LA and mandating mask wearing when you leave the house?
I'm going to ask Matt Constantine to come up and answer that question, Ralph.
So good morning. We are requiring masks, of course, in healthcare settings, and for the general public. And what we've been falling back on is the CDC guidance document that says masks should be used, or face coverings should be used, if you're not able to maintain that 6-foot distance. So this is coming up now with restaurants as we explore dine-in restaurants opening up, and about masks, and our same approach applies. If you're not able to completely maintain that 6-foot distance, then face coverings are recommended. I hope I answered your question, Ralph.
But you're not going to mandate it?
From a public health standpoint, we're adhering to the CDC recommendations. At a county level, that would be something that the board would have to consider, and not just a public health department issue. We want to make sure we're doing everything we can to protect the public, and adhering to those guidance. That guidance specifically on face coverings we think is appropriate, but there are some settings that you can't achieve that 6 foot, and then face coverings would be needed.
Okay, thank you. My second question, and I'm done. I understand this is all from the state, but church services, as Mr. Alsip mentioned, is not covered in phase 2. How do you reconcile to pastors and parishioners that I can go to Luigi's for lunch today, I can go to Casey's Steakhouse for dinner tonight, but I can't go to St. Francis Church on Sunday?
Yeah, that's an interesting question, Ralph, and I think one the state is spending a great deal of time contemplating now. I'm sure they're getting a great deal of pressure from the religious leaders in our state. In fact, I know that they are. There are conversations ongoing. I'm not sure how to answer it. I'm not sure how you reconcile it. I think that there are examples of strange things when you compare, being able to again go into a sporting goods store, retail establishment, or a Lowe's, a place like Lowe's, and not for a period of time not able to walk into a smaller business that may be selling mattresses that wasn't listed as essential. So I'll answer that by just saying that this is going to be up to the governor's team. Ultimately, they're part of stage 3. They said that they're going to move into stage 3 in a matter of weeks. I think Dr. Ghali said could be by the end of the month. So we'll wait and see. We'll wait and see what happens, Ralph. Do you have any other questions, sir?
No, I'm good. Thank you very much. I appreciate that.
Thank you, Ralph. Channel 23.
Can you hear me?
Yes, ma'am.
Can you hear me?
Yes, ma'am.
All right. All right. So we have a few questions, but I'll go with our first one. I feel like you guys have already kind of touched on this, but I was listening pretty closely. And so you mentioned that phase 3 may start at the end of the month. Now that's just 10 days from right now. So what is the county doing as far as, really planning to make those establishments like salons and gyms and other things like that to be ready to 2 days from right now, So that just like here a little bit. Wondering if you could maybe talk about how you guys are already like this. I mean, you guys are doing a good job. By the way, I think that Michelle, love you. Just want to point that out. You guys have really been taking from all of us up here with our questions, so I appreciate your work. Wanted to see if you guys are kind of setting that up about how the community can really engage to help with these types of ready for reopening, because there's a lot of small businesses that we support that are in that realm. So maybe you guys could provide some of that information, but I'm just going to couple with the other question because I feel you can knock it out in both. Have you guys been keeping an eye on how many businesses may not be allowed to, or not be able to reopen because of the economic impact? Do you guys have like a rough on the business essentially. So it's a two-part question. What's the plans for getting those other phase 2 businesses open? And essentially the second part of that question is, you know, I just mentioned it, so you got it.
Yeah, is that Tori?
Yeah, the estimation on the businesses that won't be able to make it back essentially because of the economic impact. Have you guys been keeping track of that? Like businesses that have had to close down and won't be able to reopen?
I understand. You broke up a little bit, but I got the gist. So we don't know a whole lot. We don't have a lot of specific information about what businesses are going to survive this and what businesses will not. Obviously, we get notices of, we get warn letters, which are businesses who are saying that they are, you know, announcing that they're laying, I think it's 30 or more or 50 or more people off. I don't know what the cutoff is, but we get those notices. Obviously, we're tracking unemployment numbers as it comes out. But I mean, to business, obviously, you know, it's hard to know. I mean, what we're doing about that is making sure that we're opening as many businesses in this community as we possibly can. Where we have the flexibility to provide our own guidance for certain businesses here, we are doing so, and we are getting those businesses open. We are also, I talked about it earlier, at the economic stimulus money. We are working very, very hard to get that out as quickly as possible and to make sure it is of value to our small businesses. Again, many, many changes from what the federal government did with their PPP loans. This money is going to be dispersed in a different way. I think our local businesses will be pleased. We've had discussions. We had a nice discussion yesterday with the restaurant industry and talked a little bit about it. So those are some of the things we're trying to do. We're trying to get all this. We're working really hard to get businesses back and to provide them some support. To your first question about what are we doing to prepare, we have an ad hoc committee of the board that was established. We've got Supervisor Scrivener and Supervisor Maggard who are leading that committee, supported by a group of staff here at the county. We are holding regular industry calls with groups. We are doing these calls, getting as many of these business owners in various groups on these calls to walk through with them where things stand, what their place in the world is currently under the state's rules, what they should be doing to prepare to reopen when the governor says go. And we're making sure we're doing a good job talking with them, communicating with them, and having them think through their own best practices, making sure that when we do get guidance from the state that comes down for, let's say, gyms or churches or any of these groups that are in stage 3, we're making sure that those groups get this guidance, that we walk through this guidance with them, and that is a process that we've had ongoing for the past probably 3 weeks now at a pretty robust clip.
Yeah.
Thank you very much. Do you have any more questions?
The only other one was, are you going to be enforcing it? But I imagine, you know, just based off the trend of me being a part of this, I imagine you guys are just hoping that people are accountable for themselves and realize that they're at risk for losing their licenses as well, or do you guys aren't going to be enforcing that for people like hair salons or things that try to open? I guess my question essentially is, some people may just be like, you know what, screw it, they're open, I'm going to open, and like if you guys are going to be like, you know, enforcing anything, but I understand on you guys have been going with has been community, you know, like basically relying on us to be smart. So just trying to get your answer on that, and that's my last question.
Yeah, Tori, we've really never had an enforcement posture here in Kern County. We have had a reinforcement posture.
Yeah.
We are reinforcing the governor's directives. We're making sure, you know, obviously in the news, Deja Vu opened up. It was reported. We contacted them and reinforced that, hey, you shouldn't be open. The governor has said you shouldn't be open. you're way out in front of the governor, and they quickly close down. So that's kind of the posture that we've had. It's working. I think
Yeah.
Kern County people that live here are smart, and they, restaurants, let's talk about restaurants. This is a group of people, restaurateurs and their employees, who are totally focused on safety, totally focused on public health issues. Their whole business depends on it. And in addition to good quality food and good quality service, cleanliness at restaurants, the optics, right, when you walk into a restaurant, they're important. So restaurants are really at the tip of the spear, the leading edge in making sure that patrons are dining in a safe, clean, sterile, to the extent that they can, environment. Public health grades them regularly. Restaurants receive grades. So there's a lot of public health tethers to restaurants already. So I suspect that this is going to be done. People are going to abide by the guidance, and it's going to be done very carefully and in a robust way. Thank you, Tori, for your questions. I appreciate it. Let's move on to Kern Soul. Kern Soul.
Hi, Ryan. This is Elizabeth from Kern Soul News. My first question is just a quick clarification question. Matt mentioned that 15 deaths have come from Kingston facility, but then you mentioned that those 15 deaths came, you said facilities, like multiple, more than one nursing facility. So I just wanted to clarify if there's been deaths at other nursing facilities, and if so, which other one was it?
There's one other skilled nursing facility. All the rest are Kingston. I don't know the name of that skilled nursing facility. Orchard. Skilled nursing facility is the other. So of the 15, 14 at Kingston, 1 at Orchard.
Okay, thank you for that. And then my second question is, with us reopening as soon as today, if we see, an increase in hospitalization rates in the coming weeks, are we going to have to go in reverse and shut down again, or what is the plan if there's an increase in hospitalization rates?
Well, it would have to be a pretty significant, pretty extraordinary increase in hospitalization rates here in our community. We currently, obviously, the rate of hospitalizations over a certain period of time is a metric that the governor's using. We're currently negative. We're 0. As of Tuesday, we were negative 0.8%. I believe the percentage is 7%? 6%. So we're a long ways from 6. So we would have to have an extraordinary surge in hospitalizations, and the trends that we're seeing. We've been trending about the same week in and week out for a long period of time. Obviously, yes, if we do have an issue with hospitalizations. The attestation, no matter what county you're in, these attestations come with an agreement where we're going to have to step back if any one of these criteria is skewed in any way. And upon that, noticing the data trending and trending outside the lines of the governor's criteria, this would be a discussion that public health officials here in Kern County will have with public health officials at the state level before any decision is made on how we or when we do any sort of step back to address that particular spike or violation, depending on what criteria area it's happening in.
Okay, great. Thank you. Just really quick, one more question. Just to clarify, did you say negative 0.8% and the state is 6%?
That's what I said, yes. We're at a negative 0.8.
Oh, 0. Okay, thank you.
As of Tuesday. Okay, thank you. Mojave Desert News. Mojave? Okay, Moving on, Channel 29.
Hi, this is Fiona with Channel 29. I was wondering, what is the easiest or most efficient way for people in the community to report a business that might not be enforcing face capacity limit these next few days, or enforcing face masks for customers who are within 6 feet of each other, like you said? And are there any plans to come up with financial consequences for businesses that don't comply with these rules?
So the last question is no. The answer to your first question about, there are no limit. The governor's guidelines, they don't have set limits for eating establishments, for in-house dining. Their guidelines, I would encourage you to go and look through those. They really deal with spacing, making sure that tables are spaced appropriately. You know, there are cleaning protocols in place and signage and things like that. So there's no set, you know, you must operate at 25% capacity or 50% capacity. You know, if residents have any questions or concerns, they can call the Department of Public Health. That phone number is accessible on not only the county's homepage, but also on Public Health's homepage. And you can call and ask questions or anything else you'd like.
All right, thank you.
You bet. Channel 17.
Hey, Ryan, Aton here. Just a question once more about Stage 3. We've seen what Tulare County did with moving forward with Stage 3. To be clear, to be very, very clear, I just want to hear what you have to say about we are going to wait for the state for that, correct?
Can you repeat your question, Aton? I'm sorry.
Oh, yes. We saw that, just going back to Stage 3 for a moment, we saw that what Tulare County has done with advancing further into Stage 3. To be clear, very, very clear with what you said earlier, we are waiting for the state to make any announcements on Stage 3. Is that correct?
We are, and obviously we're not Tulare. I don't know what Tulare County is doing. I just see what I read. I don't see the value in getting out in front of the governor at this point when we're not able to. Frankly, his executive orders have the force of law. Again, the state has tremendous leverage over localities, both in terms of various industries that they regulate. The state also provides the county a great deal of money through a variety of different programs. We have seen what actions like that result in a response from the administration. And so the track that we're on, that Kern County is on, is the most productive track. And I would advise Tulare to maybe recalculate how they're approaching this.
Thank you, Ryan. My only other question is regarding the stimulus funding. As you mentioned, going to a number of businesses, but you are prioritizing more than just restaurants, just to make sure that is correct as well?
Yes, sir. We're prioritizing those businesses that were either closed down or significantly curtailed, put on the governor's non-essential list. It's a variety of small businesses, but certainly restaurants are a priority. Barbershops, beauty salons, nail salons, gyms. There are others that are on that list that we will be prioritizing. And again, information related to how businesses in this community, and these are businesses all over Kern County. It's not just in county unincorporated areas. They can get that information as soon as it's available. We believe we'll have it up on our website and ready to go, hopefully by Tuesday of next week. Again, I want to say something. We are working with a group of financial institutions that have a presence. These are financial institutions that have a track record in business lending specifically. We are working with them. They have a presence all throughout Kern County. And you do not have to be a member of any one of these financial institutions to apply for this stimulus funding. There is no requirement that you become one. There are no strings attached. They are working with us to get this money out. It doesn't matter who you are or who you're banking with.
Thank you, Ryan. And final question for you is just this. And you mentioned you're in regular contact with business owners, restaurant owners. Yesterday, we heard from one restaurant owner, by we, I mean, us at 17, who said that they were nervous. They, as in this restaurant owner, he or she, was nervous a little bit about the reopening in the sense of that depending on the guidelines, this restaurant owner may only be able to have 25 to 50% capacity, of patron capacity at a time, which would be very difficult for them, they said, in terms of, financially going forward. And with that, I want to ask, is there any concern that the guidelines may be actually too strict or complicated for some of these owners?
I think that you can make an argument that they may be too strict. I mean, certainly if I'm not a restaurant owner, but I have worked in restaurants. I used to work for Ralph Frugaletti as a waiter at one of his restaurants back in the day. I get the business. Yeah, the reality is under these guidelines, some of these restaurants, they're not going to be back at 100% capacity. We're going to do everything we can to get them back as near there as possible, but it may not be possible under the state's guidelines. Right now, they have before today, they had zero capacity. So 25 or 50%, I would say, is a step in the right direction. This thing is evolving. The city of Bakersfield last night, the city council adopted a plan to allow restaurants can apply to expand their capacity in outside areas. They can utilize parking lots, they can utilize sidewalks, they can utilize patio areas. They are streamlining a permit process for restaurants in the city of Bakersfield to do that, utilize parking lots. That's going to be streamlined and done. The county is doing the same thing for restaurants in unincorporated areas, and I would call on every single city in this county to do the same. Follow the city of Bakersfield's lead, see what they did, and copy it, and get it done in your own communities. Help your local restaurants out, allow them to expand. That expansion will, if they're not able to hit 50% capacity, 100% capacity in their current four walls that they've got, this allows them some extra space in outside areas to do that. I realize that we're going into some hot months. I think in a couple, 3 days, we're going to have 100-degree temperatures. So this isn't going to be for everybody. We're doing what we can. Some people may decide where they have the ability to provide a tent and utilize a tent in a parking lot for some outdoor dining. Some people may have other facilities that are located and may be empty next to their restaurants that they might be able to move into. And our guarantee, at least on the county side, is that public health, our fire department, our fire marshal will move quickly to get you permitted for that. So all of those things are all of those efforts, including the stimulus that we're providing, are going in to try and get things rolling again for these restaurants. But this attestation, the guidelines of the governor, again, allow them to do in-room dining. It's not back to 100%, but it's a big, big positive step in the right direction, and we're going to be working with restaurants to help them along the way. I hope that answers. That was a long answer to your question. Sorry.
Yes. Thank you.
Okay. Does anybody else? I'm going to go back to Ralph because he always forgets that he had a question, and this I'm just kind of poking fun at him. But Ralph, if you're still on the line and you have a question that you forgot.
Actually, I do.
Yes, sir.
Thank you, sir.
Yes, sir.
Very gracious of you. I've had two medical professionals tell me of a case of a 50-plus-year-old man who was in ICU. This is actually for the doctor. About 2 weeks ago, he was in ICU, obviously in pretty great shape. They gave him convalescent plasma. He's now resting at home comfortably. Question is, how widespread is the use of convalescent plasma? And is the county contacting former patients and telling them to go to Houchin and give up their plasma?
Got it. Dr. Lyon,
Yeah.
Dr. Lyon's coming up to answer your question, Ralph.
Thank you.
Hi, thank you for the question. You know, the convalescent plasma is like any of the other modalities that we have for COVID. We're still working on understanding all the specifics and seeing the preliminary data come in. There have been definitely anecdotal cases where there have been benefits. And so at this point, there is no definite evidence that are helpful or harmful. I have had discussions with Houchin, and we're working with them to try to figure out the best way to facilitate that. They are accepting donations of convalescent plasma. At this point, our recommendation is for patients who have had confirmed coronavirus, COVID-19, to speak with their healthcare professional and discuss whether they are a candidate to provide donations. Thank you.
Thank you.
Okay, and we're just kind of finishing up, but I'm going to go back as a courtesy to the Bakersfield Californian. Sam, do you have any other questions? Sam
I'm all
Morgan?
good, Ryan, thank you.
No questions?
Right.
Okay. Okay, that's it for today, folks. I just want to say have a great Memorial Day weekend. This is a 3-day weekend. Please use your head. Get outside, enjoy the weather, practice social distancing, wash your hands, don't touch your face, clean frequently touched surfaces, wash your hands, don't touch your face, don't get around sick people. If you're sick, please stay home. But please, you know, if you're going out to enjoy outdoor areas, our parks are open. Please do so. Don't get into big groups and gather, certainly with people that you aren't familiar with. But enjoy the weekend, and we'll see you all next week. Thank you.